Good day, my name is Ethel Jane Superales from BC 3B, and today's video, I'm going to perform the assessment of thorax and lungs. For preparation, first we're going to assemble equipment and supplies, such as the stethoscope, the skin marker or pencil, and the centimeter ruler. Now we do the procedure. First, introduce yourself. Good day, sir. I'm Ethel Jane Superales, a student nurse of NESCOS, your assigned nurse for today. May I know your full name, sir?
Jose Morales,
How about your birthday, sir?
7/05/1996.
Okay. So after identifying the patient, we explain to the client what we are going to do, why it is necessary, and how the client can cooperate. So today, sir, I'm going to do the assessment of your thorax and lungs, wherein I'm going to touch your chest, your back, to inspect, palpate, percuss, and auscultate for the anterior, lateral, posterior of your thorax, for us to determine if there are any abnormalities. Would that be okay, sir?
That's fine.
Okay, that's great. So after explaining the procedure to the client, we wash our hands and observe other appropriate infection control procedures. So, assuming that we already done washing our hands, and after that, we provide our patients privacy. So since our patient is male but in women, we drape the anterior chest when it's not being examined. So after providing patient's privacy, we determine our client's history. So sir, first, I'm gonna start by asking questions. Do you have a family history of illness such as cancer, allergies, tuberculosis,
No.
smoking, and occupational hazards?
No.
Okay. Any medications being taken?
No.
And do you have current problems such as swallowing, coughing, wheezing, and pain?
No.
Okay, that's good. So for the inspection, we inspect the shape and symmetry of the thorax from the posterior lateral view. We note the respiratory rate, the rhythm, and the quality of breathing. So now I'm going to proceed the assessment. So first thing that I'm going to do is by observing and looking at the chest. And this is the inspection. So I'm first noting his respiratory rate is within normal limits. So that's how fast he's breathing. And the rhythm is regular. So meaning it's a nice, normal, regular pattern. I see respirations are deep, and I do not see any retractions or bulging of the interspaces, and I see you're sitting up straight, you're supposed to lean trying to catch your breath, and I see that the chest is symmetric, and I also noticed that anterior posterior ratio to the transverse ratio is 2 to 1, which is normal. And I'm gonna continue my inspection, and can you please turn back? Also looking posteriorly at the posterior chest, same thing, looking for any abnormalities for the shape of the chest, which is within the normal limits, and the chest should be shaped like a cone. So then I'm going to continue the assessment double plating the chest. So I'm going to touch you here, so then I'm going to touch the chest all over. So you're going to tell me any tenderness or pain on the area. Let's stop here. I'm going to checking for anything abnormal. So mumps, bruises, muscles pain, tenderness, and looking for the skin for anything abnormal, and I'm looking for the color of the skin while doing this, particularly looking for the power pain or cyanosis. We're percussing the lung tones as you were in the younger adults. Sir, can you please turn around again? Okay, so because I'm gonna checking the expansion of chest by putting thumbs here. So can you please take a deep breath? So in and out. Come again. In and out. So you see that my hands move in and out, in and out. Good. So the chest expands symmetrically. Now I'm going to do the auscultation as you were in a younger adult. So I'm going to continue my assessment by auscultating lung sounds. So let's start auscultating the trachea. Then I'm going to continue listening. I'm going to be listening to the full breath in each pot. And it appears side to side as it going down the chest. Okay. Sir, are you okay, or do you feel lightheaded or anything?
I feel fine.
Okay, so just breathe normal for just a second. Even in a female patient, you're going to listen in this pattern around here. Then you lift up to listen down below. So you can listen above the bra here and below the bra across. So I'm going to listen each side, left lateral. Listen to places, big breath. Okay, can you turn around for me? Just going to assess right laterally. So, listening 3 spots. So on the right, there's 3 lobes. So you listen in 3 places. First is here, then here, and then okay here. So the 1, 2, and 3 like a triangle. And then posterior, you were starting listening at the very top. So the apex of the lungs comes way up. So here, take a deep breath, open your mouth, and breathe in and out through your mouth. So I compare side to side. I'm going to round the scapula. Okay, one more. Okay. So you can turn. So over the trachea, I forgot your presence over this area. So the center near the sternum, and also at the back at the upper area, I hear breath of a vesicular breath sounds, and all of the periphery out here, and posterior and all the periphery out here, I heard a vesicular breath sounds. Okay, so that concludes the assessment of thorax and lungs. So after doing all the procedures, thank the patient for cooperating. So sir, thank you for your full cooperation. Now that we already know that there are no any abnormalities seen, and that's great. So after that, do the aftercare to the patient if unable to help safe, or ask the patient to do the aftercare if able. So we ensure that the patient is on comfortable position. So after placing the patient in a comfortable position, we do the hand hygiene. So assuming that we're already done in doing the hand hygiene, so now we document our findings to the patient's record. That is all for my video, but if you have questions or comments, just let me know. But if you don't have, then see you in the next one. Bye.